Good day, guys. Thank you so much for tuning into my channel. Welcome, welcome, welcome. Please do allow me to introduce myself. My name is Atim Nzondo. I'm currently a part-time student working towards advanced diploma in human resource management. Okay, so today we are going to cover a COVID-19 workshop. We are going to conduct a training on a COVID-19 workshop. So we might wonder, what is COVID-19? COVID-19, commonly known as coronavirus. Yes, you got it right. I'm speaking about that. Please stay tuned. Before we dive into this training program, we may want to get to know on what is it that we are getting ourselves into. Okay, so I'm going to assume that all of us accessing this information doesn't know what COVID-19 stands for. Let's take a glimpse on what is really COVID-19. According to our sources, which will be provided at the end of this video, COVID-19 stands for a potentially severe respiratory illness that is caused by a coronavirus and characterized by fever, your coughing, your shortness of breath, and etc. Okay, the virus was first identified in December 2019 in the city of Wuhan in China and has resulted in an ongoing pandemic. I'm sure we've all seen on the news. It's all over. It's a global pandemic. It has affected not only individuals, but it has affected everyone, all the communities, all the parts of the world, all the parts of the trade, all the parts of the economy have been affected by this coronavirus. As a matter of fact, many businesses have closed. Many businesses are closing. People are losing their lives. People are getting sick. The hospitals are getting full. The workforce is getting scarce. You know, it's like a nuclear bomb that just swiped everything. Yes. So the whole reason for this training is to enlighten that, is to bring that to you guys on how can we try and work together and combat this. Thank you. Now that we know what is coronavirus, what does it stand for, when did it originate, where did it originate from, we may want to know what is the aim of this COVID-19 workshop that we're currently busy with now. We may want to know what are we trying to achieve, you know, as individuals by accessing and conducting this information. Okay, so this workshop is to provide the community individuals with a practical, participatory, informative tool for COVID-19 knowledge and safe quality healthcare practices that one can use, you know, to play his own part in ending this virus. You know, honestly speaking, you may want as an individual to play your part into ending the virus, you know, but when you don't have the necessary tools, when you don't have the necessary information of ending or playing your part into this virus, then your effort, you know, might just go to the drain, because without the correct measures and healthcare practices to end this virus and information, then the virus, then your part is none of value. How did we tailor? You might want to know, how did you tailor this training program to ensure that it suits your knowledge need as a participant or as an individual that's accessing this COVID-19 workshop? Well, what happens is that this training is based on the training needs analysis tools. So we make use of the questionnaires. We distributed 10 questionnaires to participants, and then we collected the information, and based on those answers, we tailored, we came to a agreement to tailor this COVID-19 workshop. So it will fit your knowledge needs, because it is exactly based on the participants that you received, from the individuals that took part or that gave their thoughts on the questionnaires that were handed out. That is how this COVID-19 workshop was tailored. Just like in the restaurants, before you dine in to that beautiful burger of yours or that amazing salad in summer, the waiter hands over the menu. In this case, please do allow me to hand over the course agenda and lesson plan for this COVID-19 workshop. Okay, so on Module 1, we are going to cover on what is COVID-19. What is on this module? We are going to have a brief look on what is COVID-19 and how and when did it originate. On Module 2, we are going to cover our national statistics for COVID-19. So our national statistics is going to be based on the country South Africa, because that's where we currently are. Or if you are somewhere else on the part of the world, the dashboard also has a global statistics. But our main focus is going to be on the national statistics on South Africa. Our Module 3, we are going to have a look at the stages and symptoms of COVID-19 infection. By this I mean the symptoms. We are going to have a brief look on what symptoms do you get, before you are aware that you are infected with the virus. On our Module 4, the main types of COVID-19 transmission in South Africa. In this module, we're taking a very deep dive on the types of COVID-19 and what are the main types, that we as South Africans are experiencing, or what we as South Africa are experiencing for those guys who are not part of SA. On Module 5, we are going to look on the ways of preventing COVID-19 transmission. How can we as individuals prevent, the transmission of COVID-19? That's the whole goal. I'm sure you've seen on our TV programs of change, the ways are just everywhere. The knowledge is shared on how can we, that's the whole goal, to end this thing. How can we instruct these ways to try and prevent, the virus from spreading, Okay, on our Module 6, we are going to have a look at the dynamics of COVID-19 testing. We have different dynamics of COVID-19 testing. I didn't even know that, but I'm happy to share with you guys the knowledge, because I went on and did a research on that and got that there are COVID-19 dynamics, different testing dynamics. Oh, I'm so excited for this one. And then on Module 7, what to do if you are infected with the virus. On this module, we are having a look and we are taking a deep dive on how to approach it, what to do if you have the virus, who to consult, how to behave, what steps to take if you have the virus. And then on the very last module, our Module 8, we are going to take you on a step-by-step process on the treatment of COVID-19, on how can you get well from COVID-19 and be a recovery rather than being. Let me leave that for you to think about. On our Module 1, what is COVID-19? The new coronavirus known as COVID-19 was first encountered in December 2019 in Wuhan, in China. in December 2019, when I tend to think about it, I saw the headlines on the news, that there's this new type of a virus, but for me, because it was not so close, I didn't take much interest into it, I didn't take much thought about it to investigate on it. What is this thing, because it sounded like it's something that was far for me, that was far to me, that was never, gonna affect my country, or that was never going to cause so much severe, it has caused recently. I remember I thought it's one of those sicknesses, just like your swine flu that have originated before, your malaria, your Ebola, I thought it's one of those things that are just going to, disappear into thin air. I didn't really think much about it. So yeah, we get that it surfaced on December 2019. It was already, it was already hitting some parts of China, and then it has gone on to affect over 425,000 people in over 150 countries. Guys, I'm not talking about 45,000 people. I'm talking about 425,000 people and more in over 150 countries. I'm not talking about in 150 villages. I'm talking about 150 countries. So by that alone, we should get the picture of what is this thing about. And that was by then. These figures and numbers, according to our national and global health statistics, they change over the time. That was then. I know it's more now. Okay. This has caused more than 18,000 deaths. That's for sure, we know. It actually has caused even more than, because that was then. That was way before, We know that it's changing according to our global and national health statistics. Okay. It was announced on 11 February by the World Health Organization. That's very important. On the 11th of February, the World Health Organization, commonly known as WHO, first announced this pandemic. Yes. So, what's interesting here now is that the name, the Director General, Tedros, Mr. Tedros Adhanom, said, I quote, "We had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease. Having a name matters to prevent the use of other names that can be inaccurate or stigmatizing." This is very important because the World Health Organization had to come with a name that cannot be stigmatizing, cannot be misleading, cannot be similar to anything else. You may want to wonder, why is that so? It is because of the seriousness of this virus. That's where this comes from. Okay, guys, with this, I hope and I'm sure that you guys know about the history. You guys have learned about the history of this COVID-19. Where is it coming from? when did it come? When did it come to the public? What were the thoughts, before in December 2019, and how did the World Health Organization decide to use the term COVID-19? Thank you so much. Please stay tuned for Module 2. Guys, we are now on our Module 2 on our COVID-19 national statistics. Okay, it's very important, to know the numbers. Just like as the old saying, numbers don't lie. So let's try and dive deep into it. With this module, we are going to do a comparison, on two reports of national statistics. We are going to have a glimpse on our COVID-19 dashboard and take 2 dates, 2 separate dates, and try to do the comparison. We will understand the growth rate of the virus and the recovery rate of the virus and death rate of the virus, and see if are we as a nation, are we as a global nation winning or losing this battle, Okay, so this statistic is based on the date 28 July, last updated at 29 minutes past 5 a.m. versus the 2nd August, last updated at 20 to 8. Yeah, all right. So we're gonna start with South Africa. So on the first statistics, this is now 28 July, we received confirmed cases. We had 452,529 confirmed cases. That is 452,529 confirmed cases. And when we look at the second date, which is the 2nd of August, we had 503,290 confirmed cases. We can see there's a growth there. Not much growth, but there is a growth, of confirmed cases. Okay, on the death side, we were standing at 7,067 deaths. What does this mean? Okay, maybe before I can jump, to the deaths, let me try to explain what are the two confirmed cases terms mean for us, as individuals, for people who are not exposed to statistics or statistics counting or quantity. Okay, so this means that ever since the start, of this COVID-19 in SA, we are now standing at we now have confirmed people or patients 503,290 patients that are confirmed to have the virus, meaning that they tested positive for the virus. Okay, so jumping to the deaths, the death rate is as follows. On the 28th of July, it was 7,067 people. We lost 7,067 people. And then on the 2nd August, it was 8,153 people. Okay, so let me shift or make clear or just highlight here. I don't want to cause an unnecessary panic or confusion. What does this mean for us? It means that ever since the virus started here in South Africa, because this stat is based on South Africa, this first part. On the 28th of August, we had 7,067 patients that we lost from the start of the virus. So we did not lose 7,067 patients on the 28th of July. No. To that date, we had lost 7,067 people. If you want to scrutinize and filter and look how many did we lose on the day, there is a small number there. Currently, on the 28th of July, they had reports of 298 days. Yes, 298 days. And on the 2nd of August, there was 8,153 people lost from the start of the virus. Okay, not 8,153 patients lost on that day. I just wanted to clear that confusion. Okay, now that we understand this, right, we may want to go to the good news. Can't wait for the good news. I've just given you bad news on the last reports. The good news, which is our recoveries, on the 28th of July, we had 274,925 recoveries. Okay, very important. These recoveries come from those confirmed cases that I had shown you. So we had, let's use the 28th of July. We had 452,529 patients confirmed that tested positive. Out of those, we had 274,925 recoveries. Okay, and so on. So obviously, some of the patients recover on the next day from this report and so on. So as we do get the statistics from the Department of Statistics COVID-19 campaign, there's always an update on the recoveries from the start of when did the virus start. Okay, let's not get confused there. Okay, and then on the 2nd of August stat, we had 342,461 recoveries from 290, sorry. Sound like Mr. Jacob Zuma now. 290 confirmed cases. Okay, let me repeat that number. We had recoveries of 342,461 patients out of the confirmed cases of 503,290. Okay, let's take a glimpse on our global cases. So on our global cases, we had from the 28th of July 16,396,954 patients that were confirmed. Okay, and then on the deaths, we had 651,902 patients. We had lost globally 651,902 patients ever since the COVID-19 started. Okay, and then the recoveries from that 16,396,954 patients that were confirmed, patients that were recovered were 9,512,561. Okay, yes, those were our recoveries. Okay, I'm not gonna dive deep into this global cases, because as I've said earlier, our main focus is on our national COVID-19 statistics that is based on South Africa. Okay, so I hope, guys, that by this module we can fully understand our dashboard, our COVID-19 dashboard, and not only understand but also know what does the dashboard mean. Also understand the different, terms that are used, as well as link the two, the numbers as well as the terms that are used. So now, next time when you're viewing the television and you see the headlines on TV, on cases, on statistics, you can fully relate now, and you can know, what are they talking about, because this thing is new to us. It has brought so many changes to a point where there's some stuff, that we really don't know and wish to be trained or educated on. And this was just one of those stuff. Thank you so much. Our module 3. Here we're looking at our stages and symptoms of COVID-19 infections. Now this is very important, guys, because this just talks to us. This just gives you the reason to do a checkup, an introspection to check if are you not, as an individual, experiencing one of these stages, and symptoms, because it's important to know, because if you are really have the symptoms and stages, it's important for you to know so that you can go and seek help and not infect the others, Yes. Okay. Jumping to that, people with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illnesses. Okay. Symptoms may appear at 2 to 14 days after exposure to the virus, so you can get exposed to the virus and spend the whole 10 days, without, noticing anything, without displaying any of the symptoms, and then on the day 13, on the day 14, you start to show symptoms. Someone else might be exposed to the virus yesterday and start to show symptoms the day after tomorrow, So it ranges from person to person, and these symptoms range from mild symptoms to severe illnesses. So someone else might just show a symptom, maybe just a sore headache. That's not so bizarre. Someone else might display a very heavy flu of symptoms, a cough dry, a dry cough, sorry, and all of that, So let's take a look. People with these symptoms may have COVID-19. So the following symptoms, if you do have them, you as a person may have COVID-19. So we're talking about fever or chills, your cough, your shortness of breath or difficulty breathing, fatigue, just tiredness that you don't know where does it originate from, muscle or body aches, headache, just a sudden sore headache that's not ending, new loss of taste or smell. Someone just says, I'm having my dinner as per normal, but it's strange that I don't taste anything. I can't taste anything. The loss of the taste and smell, or you can't smell anything. So your sore throat. Suddenly your throat is sore. Your congestion or runny nose, nausea or vomiting, diarrhea. There are way more. I've not listed all of them. There are way more. They range, from person to person. But what we can take, what a good lesson that we can take out of this module is that there's a wide range, of these symptoms, and they vary person to person. Now that's one of the reasons that makes this virus so difficult, to beat, because it brings endless developments, endless changes, endless challenges to the healthcare. One moment we have 5 symptoms, the next we have 6 symptoms, the next we have 8 symptoms. So as people come in, the healthcare professionals learn on new symptoms. Someone says, come with a new symptom, then the health professional would be like, no, you don't have corona because none of your symptom is in line with the symptoms that I've received or people with corona showed. But then when we go to the laboratory and giving the samples come back positive, and then that symptom of that patient gets added to the list. So it's really a non-ending game, and as I've said, it's one of the challenges. It's one of the reasons why this COVID-19 is so severe, and we should try, by all means, if we experience any of these symptoms that I've just explained now, try to get medical help as soon as possible, and of course try not to cover or try not to infect other individuals in our communities. Thank you so much. Okay guys, thank you so much. Let's have a look at our module 4. Our module 4, we are covering the main types of COVID-19 transmissions in South Africa. Okay, so you get a different types of transmission. You get different ways on how one passes the coronavirus from one person to another person and so on. Okay, so we'll be covering that. So in total, we are going to be looking at 3 sets of the main types of transmissions, with the first transmission type being respiratory infection, the second type being droplet transmission, and the third type airborne transmission. So let me just explain on respiratory infections. Respiratory infections can be transmitted through droplets of different sizes. First of all, what are droplets? The droplets is when you are having a conversation with person B and your person A under the microscope. You guys are not only exchanging words, but along the dialogue or conversation, there are droplet particles that are evident under the microscope from you that are going towards the direction of pointing of person B. The very same happens when person B exchanges or replies. You guys are almost in a dialogue now. When person B replies, person B, there are droplets that are evident, that are coming from person B to person A. So in the dialogue, you guys are not only exchanging words and sentences, but also there are droplets that are moving from point A, from point A towards point B's direction, and from point B's direction towards point A's direction. That's one method on how we can pass this coronavirus. It's called respiratory infections. These are the droplets that are carried through in the air. Okay, now why is that so important? Just imagine if I have coronavirus and act as point A, having a dialogue with you, the viewer, as point B. Imagine if you are not standing a meter apart from me. Imagine the danger or the chances that you have in getting the coronavirus. You have many chances of getting the coronavirus. That is why it's very important to wear a mask at all times when you are around the community and when you are having a conversation with someone else, so that these particles or droplets can be trapped inside the mask and not find a way to go through the direction of the person you're having a conversation with. Okay, let's move to the second transmission. It's called the droplet transmission. It's very similar to what I've explained to you now. Okay, the droplet transmission occurs when a person is in close contact within 1 meter with someone who has respiratory symptoms, what we just discussed previously, e.g., coughing or sneezing. Okay, so the droplet transmission is when there is a coughing or sneezing and you are standing in less than 1 meter distance with someone. So when there's that force, it's more like the same as the previous one, but here there is a force, because the previous one you didn't have that force. You guys were just having a conversation, and the natural state or natural way, it's natural for these droplets. It's something that you're not being nasty or whatsoever. It's something that just happens naturally. We speak like that. We were born like that, And to make it even more worse, you can't even see these droplets by eye. These things can be seen under the microscope. But with the droplet transmission, it's when there is force, applied, things like coughing and sneezing, these things can then pass the virus, and is therefore at risk of having his or her mouth and nose or eyes exposed to potentially infective respiratory droplets. So you don't get this virus only through inhaling those droplets, but with the droplets transmission, because there is force applied to those droplets now, or those saliva particles, to put it that way, you can even get it through the eye, because these things are so tiny, it can go to your eyes unnoticed, and then you get infected with coronavirus. Okay. We can now confidently move to airborne transmission. Now with airborne transmission, it's different from droplet transmission, as it refers to the presence of microbes within droplet nuclei, which are generally considered to be particles. These can remain in the air for long periods of time and be transmitted to others over distances greater than 1 meter. Okay, so this is where the importance of always wearing a mask comes in. Now, with airborne transmission, you don't need to have a conversation with someone in order to pass the virus. You don't need to cough. You don't need to sneeze. It only takes your breathing, your natural breathing. That's all it takes for you to pass that virus. When you breathe, and your particles, which can be seen under a microscope, they just are all over the ear. They go all over the ear. And before you know it, you leave that spot. Let's say you were walking. You are breathing and walking and opening your mouth and breathing and walking. And then I come after you. No matter I can walk in a distance of more than 1 meter behind you, but because I've walked in that vicinity that you covered, your droplets are still alive there. And they can stay some time in the air. And I can, without knowing, breathe it in and then take those droplets that have infections and get coronavirus like that. Remember, the airborne transmission can stay in the air in up to 5 minutes, live in the air, waiting for someone to inhale it in and get infected. So this is where the mask comes in. Now, if you have a mask, there is no way that you can, or let me rather not say there is no way, because it's not scientifically proven yet, but your chances of getting that type of transmission or getting infected with coronavirus is quite limited. It's quite very less, because the idea is these would be trapped on the mask before they enter into your system. So, ladies and gents, I hope you guys have learned the different ways, we can transmit, the coronavirus, by breathing, by touching surfaces, by breathing in the air and not wearing the mask and getting it. And I hope that you will always remember your 3 ways, your 3 COVID-19 transmissions that are live in essence. Okay, it's your respiratory transmission, it's your droplet transmission, and it's your airborne transmission. Stay tuned for module 5. Thank you so much. Hey guys, now that we know how can we as individuals in the community can transfer the coronavirus to each other, I think it's very interesting also to look at how can we prevent this from happening. How can we prevent us in transmitting the coronavirus to other people? Let's jump to the ways of preventing COVID-19 transmission. Okay. So, with no wasting time, there are many ways, we can apply into trying not to transfer, or infect others with COVID-19. Whether you know that you have it, tested positive, or whether you don't know. You can be working with corona and don't know about it. But if we instill this culture of practicing these ways of not infecting others, if we can take it as if we are already infected and now we must just find ways not to infect us, then we can end this coronavirus, we can win this fight. So the first one on my list, I sampled a few, is always wash your hands more often. Washing your hands more often with soap for about at least 20 seconds, especially after you've been in a public space or after blowing your nose, coughing or sneezing, or after you have touched a surface, is very ideal, and it works. It makes sense just by thinking about it. However, it is very forgettable, Because, for instance, I can have a good cough now by not using this rule, which is what we just learned ever since this COVID-19 thing picked up. I can have a nice cough by covering my mouth with my fist, and then just forget about it. Before I know it, I forget to wash my hands, and then I greet someone or I touch a surface before washing my hands. On that note, if I do have coronavirus and infected, I've successfully made it easier for the virus to pass through the next person who can or who will touch that surface. Okay, so it's very important to wash our hands for at least 20 seconds. Okay, the second one would be avoid close contact. I think it's all over the news, it's all over the TV, it's all over the headlines when we're watching whatever series is. Avoid close contact. It's all over the malls, even in the queues now, in the ATMs. So the rule is avoid close contact with people who are sick with any other people, if possible. Maintain 1 meter between the person and other household members. Okay, so if you're in the queue, we've seen that there are lines now. You can't just stand as close as you like to someone else. You must give a nice 1 meter distance. You know, this goes back to those ways of transmitting the coronavirus. With the 1 meter apart, the chances of you catching the droplets of someone else are very less, because at least you are quite a distance to apart. So whatever that person is dropping or whatever is coming out of the other person's mouth, the risk of you contacting it with the mask on you is quite almost impossible, but not impossible. Okay, let's go to the next one. The next one is cover your mouth and your nose with a mask. You know, lately I think we're getting used to it now. I've seen progress. You know, at first when the president made this compulsory for all the citizens to wear masks wherever they go, I checked that many people, you know, some people are trying, but I checked that on many people's mind it hadn't digested, you know, as yet. You know, we're not used to this thing. You know, some people claim that the mask just makes it hard for them to breathe, and they feel clogged, they feel, you know, not comfortable with wearing them. There were quite a lot of challenges until the malls, you know, decided not to let anyone in without wearing a mask. At the shops, they were placing signs not to let anyone in without wearing a mask. So I think we're getting along that stage now. We're getting past that stage now. I've seen lately that almost everyone I bump to on the road, at the mall, in the shop, is wearing a mask. You know, we're trying, we're getting there. So that's the rule, to always cover your nose and your mouth with a mask. You know, it doesn't take much. You know, it's becoming a reality now. I've seen it. You know, I've seen people practicing it quite well. Okay, so I think we on that note, we are winning. So the idea behind this is to keep whatever is coming, the particles that are coming from your mouth, to keep it on yourself, and also not inhale someone else droplets or transmission. That's the golden rule. Okay, and then the other one is always clean and disinfect frequently touched surfaces daily. This includes the tables, the doorknobs, your light switches, your counterparts, your handles, your desk, your phone, objects, that your keyboards, the computers, objects, the phone, objects that are frequently touched, by users. It's very important to always have those disinfected, because before you know it, someone else has touched the door handles, and you come and you go and touch that. If that person has coronavirus and some sweat is left, some sweat glands are left there on that door bell, then you are infected. You stand there great chances of being infected. So it's always a wise and a good practice to always try to disinfect, these small things, to try to eliminate this virus. It's absolutely not rocket science, Lastly, monitor your health daily. Be alert for symptoms. Watch for fever, your cough, your shortness of breath, or other symptoms of COVID-19. These symptoms are not shared to us just for propaganda or just for entertainment purposes. These symptoms are shared for us to us so that we can keep track, of our health. We can try to compare what are we experiencing and the symptoms that have been shared, and try to measure to and see if they match, and if they do match, go and seek help. If you see that you have symptoms and you think that you do have this virus, it's good to go and seek medical help. But the golden rule here is to always try to monitor your health daily. Do a self-checkup. How am I feeling? Do I always feel like this? Do I feel tired? Do I feel fatigue? Do I have a headache? Do I feel sleepy? Do I feel I just woke up but I feel slump? I feel like I'm very tired. It could be a sign that I have corona. Let me try and seek professional medical help. Okay, guys, this was a very beautiful module, because it actually touches what we are facing, on a daily basis, and I hope that you are going to use these practices that you've learned now here, and you are going to apply it, in your daily lives. Thank you so much. Hey guys, thank you so much. Now we're looking at module 6. We are having a dive in on dynamics of COVID-19 testing. How is this COVID-19tested? For me, that I know, it's very scary, and I know some of you guys know that you've seen it and you thought, is this a myth, or is it true that the COVID-19 is tested like this? If you haven't been tested, it's very scary, guys. Okay, but anyway, I'm gonna take you through to it. I'm not trying to scare you. So the COVID-19 testing involves analyzing samples to assess the current or past presence of SARS-CoV-2, that is COVID-19. The two main branches detect either the presence of the virus, or antibodies produced in response to infection. So what do they really mean by that is that after this sample is taken from you as an individual, they assess the presence of the virus. So the presence of the virus would, of course, test you positive. There is the presence of the virus. They can see the presence of the virus from the sample. But there's also another way of them detecting the virus if they can't really find the real, the actual virus, and that is the antibodies produced, the presence of antibodies produced in response to infection. So when you as a person gets infected with this virus, this COVID-19, there are antibodies that your body produces to fight off this virus, and these antibodies don't just come alive on your body. They come alive if they are fighting the COVID-19. Now that's another way to see that, okay, there is a coronavirus on your body, just like you would go to another country and see the soldiers everywhere. Then you do that automatically gives you a hint on your mind that, okay, there is war in this country without anyone, telling you that, okay, there is war. You see gun blazes and soldiers shooting and all that, then okay, there's war. So it's the very same concept they're using. When they see that there are antibodies in your body, the antibodies that fight off the virus, then they know the virus is here because these antibodies are activated. Okay. And then that's how they test the COVID-19. I've provided some pictures that I took on the net on how they test when they were testing a patient. Okay, so on the first picture, the demonstration is when they insert a swab, on your nose, straight down your nose to here, okay? The second, and then they take that sample and send it to the lab. The second picture demonstrates of a throat swab, where they take some saliva from your mouth, and then they take that sample and straight to the lab, okay? So those guys are the dynamics of COVID-19 testing. All right. Thank you so much. Now it comes to our module 7, the favorite. Why is it the favorite? Because this question has been roaming around. What do you do if you are infected with COVID-19? First words you type on Google, what do you do? Then the Google just finishes for you if you're infected with COVID-19. That means that people around the world, around the globe, have been searching and wanting to know, that. Okay, so today we're covering it. What does one do when he or she is infected with COVID-19? The first step is don't panic. Do not panic. The vast majority of cases are mild, and most people are going to recover just like they do from a normal cold or flu-like illness. So do not panic. It is not a death penalty or something to scare you, or something that will leave you paralyzed, or most of the cases are mild, and chances are if you're using the correct methods and practices, you are going to recover just like you recover from the flu. Okay, so don't panic. Okay, and then the second one, stay at home and call your doctor or seek medical attention. Try not to go all over the show, okay? Because you possess a threat of infecting the others, okay? Call your doctor if you have any of the symptoms that we have mentioned, from cough to high temperature to weakness, shortness of breath, etc. Your doctor or the nurse or any other medical professional will assess your situation and might be able to give you advice on how to treat your symptoms at home without needing to see you in person, which would reduce the number of other people you expose the virus to. That is the golden rule. That's why, and with this heading, we say stay at home. You may wonder, why should I stay at home on my couch if I have coronavirus? But the golden rule behind this, or the idea behind this, is that to get the doctor, to actually do a diagnose and explain the methods and treat you telephonically without your presence, at the hospital or at the medical center. Now that, as I've explained, is going to reduce the chances of you passing the virus to other people. Okay, and number 3, follow the doctor's instructions. Okay, continue to monitor your health and call back if your symptoms worsen. Make communication with the doctor and follow your doctor's instructions. Okay, number 4, do a self-isolation. Isolate yourself until your cough, your fever, and other symptoms go away. All right. Now, isolation means that nobody can come. Your girlfriend is not allowed. Your boyfriend is not allowed. Your mother is not allowed to come in where you isolated yourself. Your father is not allowed. You need to be in an isolation camp or isolate yourself. You cannot have contact with other people while in isolation. You need to respect that if you want to heal and not infect the virus to other family members, because they might not be lucky as you are. Say for instance you are staying with your grandmother or grandfather. Just imagine if you possess a risk of infecting them. They stand at a greater risk of contracting the virus, and to them the recovery is going to be tough than you. So do the right thing. Do a self-isolation. Look after yourself. Get plenty of rest and keep yourself well hydrated. Number 6, practice good hygiene. Wash your hands for at least 20 seconds. Cover your mouth with a tissue, or elbow when coughing or sneezing. Clean surfaces like doorknobs, tabletops, bathroom fittings, keyboards, tablets and phones, etc. And lastly, just like my president, always wear your mask. Always wear your mask. You may be wondering why I gave the entire training that I gave now without wearing a mask, but then my team that I'm working with, they are equipped with the self-protecting PPEs, and I needed my audio to be heard by you guys. So I prepared with that, and I followed very safety precautions. But I saved this moment to actually demonstrate to you guys on how to wear the mask and how to apply the mask. Okay. And number 7, if your symptoms worsen, make an appointment with your doctor and let them know in advance that your symptoms have worsened and that you are not getting better. This way, they can take steps to prevent others at the office from being infected. Ladies and gents, I thank you so much, and I hope that you are going to take the steps that are provided you on and make use of them on your daily lives and activities. I thank you so much. Thank you so much, guys. And then we are moving to our last module of this COVID training workshop, and that is the COVID-19 treatment. You know, already I can sense that there are already high hopes with you guys, thinking that I maybe came up with a treatment. But honestly speaking, there is really not known drug or vaccine that cures the COVID-19 disease. However, below are proven home and hospital remedies that seem to work if correctly applied and followed correctly. Okay, at home coronavirus treatment that seem to work if your symptoms are mild enough that you can recover at home. You should. Okay, rest. It can make you feel better and may speed your recovery. Just a normal rest, you know. Stay home. Don't go to work, school, or public places. Drink a lot of fluids. By this we mean water, water remedies. You lose more water when you're sick. Dehydration can make symptoms worse and cause other health problems. You know. Monitor. If your symptoms get worse, call your doctor right away. Don't go to their office without calling first. It might help. Okay, I know that they might tell you to stay at home, or they may need to take extra steps to protect staff and other patients. That's why it's important for you to first call and just not jump to the gun and go to see your doctor without announcement, you know. The coronavirus treatment in a hospital settings, you know. You don't need to go to hospital or emergency room if you have basic COVID-19 symptoms, as we explained. You know, that's treatable on your own with isolation and just following the correct home remedies that seem to work, that I just mentioned. Like a mild fever or cough. If you do, many hospitals will send you home because, you know, there is already a high number of patients that are admitted, and the space in the beds are quite not enough. And because this is an airborne transmission type of disease, the hospital doesn't also want you to infect others, you know, along the way, as I explained. If your case is severe, members of the medical staff will check your signs that the illness is causing more serious problems. They might check the levels of oxygen in your blood, you know, with a clip-on finger monitor. Listen to your lungs. How are your lungs breathing? Give you COVID-19 test. This involves by putting that 6-inch cotton swab up both sides of your nose for about 15 seconds, what I explained earlier. Okay, give you a chest x-ray or CT scan. You might also get extra oxygen through 2 small tubes that just get inside your nostrils. Okay, in very serious cases, okay, doctors will connect you to a machine that can breathe for you, called a ventilator. But these are quite, you know, limited. We would rather not abuse these and leave it to the most vulnerable people, such as the old people that need them the most, you know. And that, guys, is what I have for you under COVID-19, you know, treatment. I don't go now and say, Mr. Nzondo has a COVID-19 treatment and that you can refer to him when you want to get treated. These are just sharing just remedies that seem to work fine, you know, with individuals that have tested positive and they have healed from using these practices. But in actual truth, there is no home proven, you know, remedy to cure coronavirus. We're still hoping that we will cross that bridge. We're still hoping to cross that bridge, and we're still hoping that there will be a vaccine. And thank you, guys, and that's it for me. What you can do for me is that you can just stay safe and wear your mask all the time, okay? And try to keep the distance together with one mask at a time. We can beat this coronavirus. Cheers.